Lynn, I have some terrible news for you. You have brain cancer. Wait, don't flail yet. There is an alternative.
There is?
Yep. It's called personalized medicine.
What?
Well, personalized medicine is a form of medicine that is tailored specifically to a person's genetic profile. It's a fairly young process, but it works wonders.
Whoa, how does it work?
Well, it's a complicated process that goes all the way down to the molecular level.
You have to start by getting your genetic profile, or your genetic prognosis for certain medical conditions. To do this, doctors need to use certain types of technology to access your genetic profile.
Sometimes doctors use a form of technology called a SNP chip.
A SNP, or single nucleotide polymorphism, is a DNA sequence variation. Doctors use SNP microarrays, or SNP chips, to map out a person's genetic profile, or a SNP profile.
And with a person's specific SNP profile, scientists are able to design a medication regimen with the help of your friendly doctor, that's me, that is specific to a person's genetic information. It's cool, right?
Well, it sounds cool, but I have some doubts. Like, first of all, will I be discriminated based on my genetics?
No, you won't. In 2008, Congress passed the Genetic Information Non-Discrimination Act.
Tina.
That prohibits the use of genetic information to deny health insurance or as a basis for hiring decisions. So you cannot be turned away from a job discriminated against because of your genetics or be denied health insurance.
Okay, so I get that. But what about patient privacy? Who owns my genetic information legally?
You own your genetic information unless you specifically say otherwise.
As for patient privacy, certain companies are making sure that only authorized personnel have access to the genetic information. Besides, another step that companies like Astellas Pharmaceutical Company are using is that the patient is identified by a number and not by their name. This keeps the patient's identity hidden.
Like a superhero's alter ego.
So like Mr. Puny?
Yep.
Anywho, how long does this whole process take?
The main motive of any pharmaceutical company is safety. Just like when you were a little kid, you were always told to ride your cute little tricycle safely.
I never had a tricycle.
Okay. So traditional medicine takes anywhere from 7 to 14 years to go from an idea to making the first dose. Personalized medicine is no different.
Dang.
Well, that's actually a good thing. The drug has to undergo a massive amount of tests in order to make sure it's safe. Remember, in medicine safety, their motto is, well, safety.
Gee willikers, that's neat. But are there any health risks or side effects?
Well, because personalized medicine is, well, personalized, side effects are generally very insignificant to non-existent. This is because the medication is tailored to your genetics. This allows scientists to see how your body will respond to certain medicine and the side effects, and then they're able to create a medication that is just right for you.
As for the health risks, there are some, but they're usually not caused by the medicine because it's personalized. It's usually more human errors, like data handling, which can easily be solved by training your staff to be more vigilant of what they're doing.
Can I just waltz on over to Walgreens and get some of this personalized medicine?
Sadly, you can't.
Sad face.
First, you have to give your doctor a DNA sample. This is very painful.
Oh no!
Just kidding.
It's actually painless.
The doctor sends your genetic information to a company like Astellas, and they compile a SNP profile using a SNP chip.
Hey, I remember that.
When the results come in, the company looks at your profile and designs a specific medication that is personalized to your genetics.
So a pharmaceutical company does the whole process?
Yes, and it's quite impressive. Having personalized medicine could lead the way into discovering cures for rare medical conditions, such as brain cancer. Right now, we're in the process of trying to convince Astellas Pharmaceutical Company to lead the way into developing this technology.
Astellas should begin to develop personalized medicine in addition to genetic testing in order to allow people with rare forms of medical issues to live long, healthy lives.
Now that you have reassured me that personalized medicine is the way to go, I think that it would be the perfect decision for me to cure my cancer. But I just have one more question.
What's that?
Who is that?
You didn't see anything.
Chris is so weird.